So, as you know, you're chief operating officer. Uh, in your budget, probably if you have to make cuts because of these changes, there's no way to do substantive cuts without hitting people because that
That's right.
your human
That
resources is your number one line item. You can't save enough on paper clips and copiers to make any dent. So one of the downstream effects looks like, unless things change, that a lot of these providers will likely have to lay off clinicians. Do you think that's true?
I do think that's true, Denny, and I would also just mention a lot of organizations are coming to me, for consulting on this because they want to know, do we make austerity cuts? Do we, try to trim, like you had mentioned, on office supplies? Quite literally, one was asking, what programs to shut down if I felt there were any that were at risk. And I don't think that austerity cuts are going to, help providers weather the storm fully, so to speak. Like I think that there's many different strategies and things that need to be planned for strategically that include perhaps some cuts, but ultimately it's about pivoting and looking towards other ways to braid your funding or do things that are innovative like adopting tech and making efficiencies kind of priority rather than just cutting all of the positions that are mainly funded by Medicaid. I mean, the system will have some knock-on effects occur, such as consolidation. I think that there's states such as Arizona where there's a lot of different players in the behavioral health field. I mean, there's hundreds of providers, and so I predict a lot of M&As, mergers and acquisitions occurring. I think that people are already starting to kind of go down that path. And then others might just have the acquisition side and be absorbed into larger organizations that have the bandwidth to support them. And so, yeah, I completely agree. I think that there are, looming cuts, so to speak, but I don't want to spread panic. I want to spread planfulness, right? And so that'll be a theme of kind of the conversation as well.